So as we kind of dive into tonight's session, I'm going to just take a second here and I'm going to double check. Sam, do I have the ability to go to the next slide, or how does this, since we're sharing hosting?
I will click for you. Sorry about
Okay.
that. I'll click over.
I will just say next slide, please. We're super casual here, so we have a few people here tonight that are going to just be sharing different pieces of information. Obviously, we've got Sam. You can kind of hear her called out on one side. Our area director, our fearless area director, as I think most of you probably engaged with her at some point. Myself, and I see I even misspelled my own name. That's terrible. So Sarah Dixon Hackey is my name, and I volunteered with the organization for about 7.5 years and have transitioned into this role as field representative, and just honestly just really excited to be moving in this direction with all of you. We are extremely fortunate to have Mary Weiler here tonight, who is our state chapter founder. And so always a blessing to have her bring her words of, I think, wisdom and origin stories, kind of how I look at it. And then one of our board members, Dr. Brian Gale. So really just kind of blessed to have, I think, a little bit of everything here as far as different voices. So let's take a look at kind of what our agenda is. We have a pretty full agenda. We'll try to move through it pretty swiftly. Obviously, we've kind of connected with one another. We do want to just refresh everybody's, I think, kind of awareness or comfort with the concept of advocacy, particularly with AFSP. Even if you've done advocacy in other avenues, you know, it's really important that we together bring a unified message, and that we understand that there are certain kind of parameters that we want to maintain as far as safe messaging and really, I think, being clear when it comes to meeting with our legislation. So along with that, we'll have a chance to look at advocacy, kind of what we call 101. So just some critical foundational pieces. Dr. Gale will walk us through some of the suicide facts and figures that specifically affect our nation and our state. And what I'll be talking about towards the end is really looking at what our priorities are this year for action issues, and what that means when it comes to each of you kind of moving forward with your own initiatives. We'll of course close with any sort of questions and answers. Feel free though, if you have a question, this is not meant to be a quote lecture. I want you to feel like you can jump in, and if you have queries, feel free to pop those in, okay? So I'm going to hand it over to, I believe it's Mary is next, and to kind of open up our session.
Oh, thank you so much, Sarah. Can everyone hear me okay?
Yep.
Okay.
We can hear you, Mary.
Thank you. Thank you. Well, this is part of my tribe on that picture. Can you go back? Yeah, on my story. A lot of my grandkids are there. I'm going to talk about, in my story, relationships and connections and mission and service. And my survivor story began in 2005 when we lost our daughter Jennifer to suicide. Jen was one of 8 children and was loved for her sense of humor, her intellect, her exceptional gifts of music, and her advocacy for the preservation of our environment. Our family met shortly after she died and decided to bring the first Out of the Darkness Walk to Fargo in September of 2006. The chapter was chartered in May 2007, and we had the first support group for survivors of suicide loss in June of 2008. It was really through the relationships and connections that our family had throughout our community and the state that helped us form the first board of directors and the expansion and growth of the walks. And at last count, we had 10 walks last year in our state. I've had the privilege to serve many levels at AFSP as chair of the National Leadership Council and current chair of the chapter board and member of the national board. I was also a member of the Public Policy Council, and I attended the advocacy forum in DC several times. And that's a time where field advocates can go and meet their Senate and House representatives in person. I had a great experience the first time I did that, and I want to share an example of the impact of just one meeting in DC at the Advocacy Forum. I met with Senator Heidkamp in person, and a very strong connection was made with her and her office staff that continued through the years. She had personally lost a friend of her family in her small town growing up. Then in 2018, I got a call from her office saying that she wanted to hold a summit on suicide prevention here in Fargo. I was fortunate to be asked to be on the panel to speak about our chapter. It brought advocates and professionals from all over the state to speak about mental health and suicide prevention, and including the Vice President, Mike Lama from our national office was able to attend. So this is just one example of how building relationships and connections by contacting your senators and representatives can be very powerful and can open up all kinds of opportunities. In both my professional work and volunteering in the nonprofit world for almost 45 years, it was vital to me that the mission of these organizations that I worked for or volunteered matched my values and beliefs. I strongly believe in the AFSP mission. Next slide. To save lives and bring hope to those affected by suicide, because I have personally experienced a devastating loss. And I believe I can only do that through service, by serving those in my own community and expanding services and programs regionally and across the state. Next. As you can see, service is defined as someone that has the intention to actively live out the mission by doing what is needed to advocate for change. So what's needed? It's the combination of relationships, connections, and advocacy that are needed to make lasting change. Next. So why is advocacy important? Next slide. Advocacy seeks to ensure that all people have their voice heard on issues that are important to them. And it also seeks to have AFSP views considered when decisions are being made about people's lives and mental health. Next slide. What can advocates do? Well, we can listen to concerns and points of view. We can help explore options to support or oppose legislation. And we can tell our personal story to those who don't understand the issues and concerns. And I can tell you that your personal story will have the most impact on those that you meet. Next slide. So there's a couple of helpful hints that I thought I would share that have worked for me. Next. There's two ways that I have approached advocacy, and the first is education. We work to bring a relevant issue by utilizing our existing and our new relationships to educate the public. And by accessing AFSP advocacy educational materials, advocates can educate officials, elected officials, and their staff. Next slide. And second, it's through policy change. It is the most visible result of advocacy, a change in a way our systems operate, getting House and Senate bills passed. And you will probably hear about the 988 system that we hope will be approved in North Dakota. Next. Now, when I first got involved, I did have my own personal challenges in the beginning because I wasn't sure what my role was as a field advocate. I wasn't sure what I could or couldn't do. And when it began, I wasn't sure how to use the Action Center, but I was able to get some training. And finally, arranging my personal schedule and time with my family and work. Whatever it is, next slide. I know now when they say we are here for you, they mean it. The public policy team in DC under the leadership of Senior Director Nicole Gibson is first class. They are responsive to our chapter and extremely knowledgeable. And there are trainings and webinars that are available now for you that I didn't have when I first started. And you have Samantha Christofferson as the area director, Sarah Dixon Hackey as our field ambassador, and Sarah Dukart, co-chair of the advocacy committee, who are extremely supportive and will help you in any way they can. Next slide. And remember, we are the Grassroots Network. We advocate at the local level to affect change on the national level. And they can't do this without us. Thank you so much for letting me speak tonight.
All right, everyone. I'm Samantha Christofferson. I'm the Dakotas Area Director for the American Foundation for Suicide Prevention. Mary, thank you so much for you have this special gift about making things just feel more comfortable and more welcoming, and really you make things just great to understand. So thank you for joining us tonight, for speaking with us, and just being you. So and on behalf of AFSP, again, thank you to all of you who are joining us tonight for State Capitol Day. I really should note the American Foundation for Suicide Prevention's volunteer field advocates make an impact in many different policy areas for suicide prevention and mental health. Policy priorities are determined every 2 years by volunteers on the national level, AFSP Public Policy Council, and the public policy staff. And again, they're located in Washington, DC. Staff work with chapters to determine which policies will make the biggest impact for each state. You can visit afsp.org/priorities. Again, that's afsp.org/priorities to find more detailed information on our top policy issues. There you can also view and download our full list of policy priorities for the next 2 years, and more information on public policy. So we are going to watch a short video that highlights the impact that thousands of AFSP advocates across the country are making by being a part of AFSP's State Capitol Day. So we're going to watch this quick clip.
Each spring, AFSP volunteer field advocates storm state capitol buildings across the country. They raise their voices in support of suicide prevention policies that can save lives. State Capitol Day events allow advocates to meet with legislators, share their stories, provide resources, connect with the community, and save future lives. AFSP advocates are making an impact across the country, sharing one message: suicide is preventable. By creating connections with public officials, AFSP advocates raise the volume of protections for the LGBTQ community. Resources, training, and policies for K-12 schools and higher education. Training and programming for veterans, first responders, and healthcare professionals. Mental health parity. and state suicide prevention plans and initiatives. Join the thousands of AFSP volunteer advocates across the country who are bringing hope and saving lives through advocacy. Together, we are changing the landscape of mental health and suicide prevention. Visit afsp.org/advocacy for more information and to sign up as an AFSP volunteer field advocate today.
All right, that clip really gets me riled up and ready to advocate. So I want to thank you for watching that with us. Now we're going to switch gears a bit, and we are going to focus on Advocacy 101. When talking about suicide, it's really important to use safe messaging. AFSP advocates come from many different backgrounds. Some have lost a loved one to suicide. Some have their own struggles or support someone that struggles. And some are professionally invested in this space. Telling your story can save lives, but only if you share it safely. Sharing your story lets people know that they are not alone and shows them that recovery is possible. If done safely, your story will encourage people at risk to seek the help that they need. So a few things that I really, really want you to remember: you should be in a safe place in your recovery when sharing your story. When sharing your story, avoid discussing details and methods, as this may be triggering for those around you. We want to avoid glorifying suicide by using terms like successful attempt. Instead, we want to use phrases like death by suicide. We want to avoid the word commit, as we often relate this word to crimes. Instead, say something like that person died by suicide or they took their own life. Share mental health resources as the National Suicide Prevention Lifeline or the text line. And again, we'll say this a few times, but also practice. The more comfortable that you are sharing your story and talking about suicide, the more that we can break that stigma associated with mental health and suicide. So as you begin your advocacy journey, it's really important to know what resources you have at your disposal in our state. State legislative websites offer real resources to advocates. You can identify your legislator and their contact information. Our information for North Dakota is on the screen. And again, we will send it in a follow-up email as well. So again, that website is www.legis.nd.gov. You can search for legislation that has been introduced in current legislative sessions and find laws that have been in our state. Each advocate is also encouraged to sign up for newsletters to find out what relative events and advocacy opportunities may be coming up within the state legislature. The American Foundation for Suicide Prevention offers several resources to new and seasoned advocates. If you're interested in learning more about the specific policy areas that AFSP works on, both the federal and the state level, you can visit afsp.org/advocacy. Again, that's afsp.org/advocacy to download the 2021 to 2022 federal and state public policy synopsis. You can also download really policy-specific issue briefs at afsp.org/priorities. Again, that's afsp.org/priorities. The Public Policy Office also hosts and shares webinars and sample meetings videos for new advocates that are available at afsp.org/advocacy resources. Again, that's afsp.org/advocacy resources. You can also visit the AFSP Action Center at any time to see what legislation AFSP supports and where bills are in the legislative process. We will highlight the Action Center later on, a little bit later, once there shows more information about our public policy priorities. All right, connecting with lawmakers. When speaking to legislators or their staff, remember to be polite and thank them for their time. And be mindful of the language that you use that we talked about in the earlier slide. Then share your connection to the cause, offer to be a resource, and include a policy ask. We're gonna talk more about our issue brief in a little bit. Remember to be brief, and then think of this as your elevator speech. An example of something that I could say something along the lines of, my name is Sam. I was impacted by suicide through the loss of my dad. I'd like to work with you in your office to ensure that the 988 crisis line and First Link is supported in North Dakota. I can share more information with you about local AFSP chapter and how we can work together to prevent suicide. I'm really excited to be here, and I'm also happy to answer any questions that you might have. In your communication with a legislative office, if you don't know the answer, I assure you, it's completely okay. Say, I don't know the answer to that right now, but I'll be happy to find the answer for you and follow up. That actually provides you a great excuse to follow up with that person and make future connections. And again, just want to say it multiple times. It's okay to not know the answer to something. I work for AFSP and I say I don't know all the time. So we definitely want to know that is okay. So moving on to talking more about becoming a resource. There are a lot of ways to utilize the American Foundation for Suicide Prevention and state advocacy tools that are shared today to really build relationships and stay connected with your lawmakers throughout the year. Again, this is more than just event, right? This is about communication and creating relationships. As a volunteer field advocate for AFSP, you'll receive emails from the public policy team that will prompt you to email your members of Congress and state legislators through the AFSP Action Center. You can also meet with legislators or their staff throughout the year in person or virtually. The AFSP public policy team is happy to work with any advocates on talking points for meetings. And I do want to add, you can find what your legislators are doing locally to support suicide prevention and mental health by signing up for newsletters and following them on social media, so you know when they are hosting events in your area. Many town halls and legislative meetings are still being held virtually and offer increased opportunities for advocates to become really engaged in that legislative process. I want to thank you so much for kind of going over that Advocacy 101 information with me and learning more about the resources. Now we are going to pass it on to Dr. Brian Gerl, who is an active board member, an active volunteer, and also, again, he is a board member from Bismarck, North Dakota. All right, Brian, you can take it away.
Thanks, Sam. So my name is Brian Gale, and I am in Bismarck. I lost my father to suicide. So we're going to talk about these statistics, facts, and figures now. The Centers for Disease Control and Prevention, the CDC, collects and shares data on the number of suicide deaths in the United States each year. It typically takes about 2 years for this data to be published. So the most recent data available that you see here are from 2020. Suicide is the 12th leading cause of death in the United States. In 2020, we lost 45,979 Americans to suicide, making it the second leading cause of death for ages 25 to 34, and the fourth leading cause of death for ages 35 to 44. Over a third of those who died by suicide were over the age of 55. It is estimated that for each suicide death, there are 25 attempts, which works out to be more than 1 million attempts each year. Next slide. This is part of the AFSP National Fact Sheet that is available at afsp.org/statistics. What you are seeing is a comparison of the suicide rates across the country. You can see that North Dakota is in the top third of suicide rates in the United States. Next slide. Locally in North Dakota, suicide is the 11th leading cause of death overall. For our youth and young adults ages 10 to 34, suicide is the second leading cause of death. And suicide is also the second leading cause of death for those aged 35 to 44. For North Dakotans, 45 to 54, suicide is the seventh leading cause of death. Next slide. Okay, Sarah, it's all yours.
Thank you, Dr. Gale. There we go. I think I'm unmuted. Can you hear me okay?
Yep.
Okay, awesome. Thank you.
We can
I-
hear you, Sarah.
Wonderful. And I saw Twyla, you popped on. I just wanted to say we do see you and we're so glad you're here too. So thank you for joining us. I'm going to kind of move into more of our policy priorities for this year. And so I certainly encourage you, I know some of you were on your iPhone, but if you aren't, feel free to take screenshots of the info that we're using tonight or that we're sharing, as well as you will get some of this emailed out to you, certainly as information, or if you want to do, you know, a photograph of the data, that's fine too. But what we're really focusing on this year and what essentially what we call our ask will be is the implementation of funding for the 988 crisis response system. And so when we use this term ask, it's really kind of this concept of you know, our opportunity to get in front of our legislators and essentially formally propose to them that they support these initiatives. So the brief that our national offices have put together, I think has done a really fantastic job of highlighting the core aspects of 988, but I want to go over this tonight with you. Quick show of hands, how many of you have heard of or are familiar with 988? Okay, Callahan, a few of you, all right. Dr. Gale, yes, you are now familiar. Okay, wonderful. And so let's go ahead and move to the next one. Next slide, please. There we go. So for those of you that are familiar with this, this certainly is an issue that you may have been hearing about for a few years. But if we move to the next slide, we can see a little bit more in relation to what this really entails or what we're talking about. So implementation of what we consider to be one of the critical points is the funding of this 988 crisis response. So yes, the 3-digit number is important, but we're talking about a larger issue here, which is a crisis response. It's a system, it's a 3-tiered leg, if you will, or 3-tier table. And so if you consider what the two most primary critical pieces are, the first is really that we're looking at any sort of kind of support that we want our legislation to engage in order to really implement a 988 fee in our state of North Dakota. And then we want to see ongoing general funds to support FirstLink, which is the organization or the crisis center that is working with this national system so that we can have a successful and an ongoing launch of the number in our state. So on the next slide, if you look at a little bit of what we break down into what we consider our crisis lines, right now, as we kind of know it to what it stands, the National Suicide Prevention Lifeline is really, it's not a building, okay? So that's what I want to just clarify. It's essentially a network of really state and local crisis centers. And so FirstLink is the one that really has been certified as our crisis center. It's gone through the training, it's gone through the auditing of it. And it's linked to this 24/7 toll-free number. As we've noted, it's 1-800-273-TALK. Realistically, what has been debated and understood is that that's a very long number to try and recall when you're in the middle of a crisis. And so there's a number of reasons why 988 was pushed forward, but we really are excited about the fact that this is going to be rolling out, and the goal or the deadline is really July of 2022. So it's coming very soon. But what happens is that ultimately callers are going to be connected with a call center in their own state. when they call this 1-800 number. Now, if that local center is unable to answer, if there's not enough people, if they're busy talking to other people, that lifeline then gets rerouted to one of the kind of 9 backup centers in their network. And the challenge here is that that may or may not be in state from the caller. We actually have a really, really high kind of call answering rate for FirstLink. We're 90%, which is one of the highest call receivings percentages across the country. So they do a fantastic job, and we want to keep supporting them so they can continue to do that. Yes, Sam says go FirstLink. So if we move here to the next slide, there's some things that certainly want to consider as we go down kind of that future pathway of what this is going to look like. There's obviously a lot of potential here, but whenever you implement a new system and you bring in new potential kind of participants or callers, we're going to have some growth periods. And there are, those potential gaps that we see in local services. And we want to make sure that we don't lose any sort of people along those ways as far as connecting them to calls. So we want to make sure that those gaps are filled, that they're bridged. We also want to make sure that because the Lifeline has proven itself to be a critical and extremely necessary piece of the larger picture of crisis response, we need to make sure that it's funded properly and that it's not patchworked with intermittent financing. It needs to be consistent and it needs to be reliable. So the other thing that's really critical, if you look at the bottom here, and I think this is the big one, is that the anticipation is that there's going to be increasing call volume exponentially over the next several years. Even in the first year, they're anticipating at least anywhere from 1 to 3 million additional calls because of the added awareness and the promotions and just kind of the access to this system. So we need to be able to handle that influx. On the next slide, if we kind of move ahead here, we can see that we are dealing with a national program and there is federal funding, but I want to really clarify something that I didn't understand until I spent a little more time kind of looking into this. When it comes right down to it, our local centers like FirstLink get limited dollars. And so in order to cover staffing funds, in order to be able to give them the benefits that they need as far as healthcare and things like that, they're truly reliant on our states to help support that, whether it's through the dollars they're getting or the contracts that they're trying to bid in order to maintain overhead. And that's a lot of pressure to keep a center that truly is on the front lines at the very beginning of our crisis system. And so we believe wholeheartedly that our state governments have a responsibility to provide this funding to enable our systems and our center to be successful. Let's go ahead, next slide. So the good news is this, and this is what I think is really great for all of us. In 2020, so in the fall of 2020, our government, our national government, did pass what's called the National Suicide Hotline Designation Act. And what that does, and I think what's critical about this, is it truly opens the door for not only that 988 number to be designated as the National Suicide Prevention Lifeline, but it also empowers each state to enact those laws so that they can assign a service fee to that 988 number. But we need to make sure that our legislators do that, right? And that's part of the ask that we're going to be implementing into this conversation this year. But it's also, as I said before, coming soon. So July is not that far away. I know it feels far away. Most of us are sitting going, oh my gosh, it's what, going to be below zero again soon. But it's really not that far away. And so we need to get our legislation thinking now and moving in that direction. So next slide, please. When I look at our system and how many people that truly I think we serve every single day with these types of crisis response systems, we know that people's lives depend on being able to talk to someone and have someone that's caring pick up those lines in a timely manner. And so we want to make sure that when it comes to what we're asking, that we're very clear. And there's three, I think, critical things that we want to focus on. So again, I'll say this again. Number one, we want our centers to be able to have the capacity to answer this increased call volume. All right, so that's the first critical piece. The second is that we truly want our callers to be able to connect 24/7 with a center in their own state. Now, FirstLink is doing a phenomenal job, but what about those 10% that get kicked to a different caller that's not within North Dakota? Wouldn't it be amazing if we could do 100%? So the third piece that we really want to think about is that, again, this is just one piece of a larger system. So we want to make sure that when we're thinking about the funding, it's not just about the staff, right? It's not just about a building. It's about a larger system that we're trying to create that truly has not only intervention, but postvention and wraparound services and care. So a system that is inclusive and that hopefully is reducing the numbers that we see each year. Go ahead, Sam, next slide. This is a slide I would love for everybody to take a snapshot of if they'd like. I like to have this stuff on my fridge or on my phone, especially if I'm chatting with someone and I'm like, oh man, yes, I've got this number right here, or I can send it to you, I can text it to you. These are, I would say, 5 of probably the best numbers to have in your speed dial or to share with others as needed. But you know, information is power, right? And being able to have that in a minute is critical. So again, if you want to take a screenshot or have this, you know, just hold your phone up and take a picture, I'll just pause for a second, let you do so.
Can you send that out? It's really little in my screen.
Yes, we absolutely can.
Definitely. I would be more than happy. I will send it as a screen, an attachment in the follow-up emails.
Okay, thank you.
Yeah, those teeny tiny little things. Phones are great for some things, but there we go. All righty. So let's go. I want to talk a little bit about action items. How many of you here have done Day at the Capitol before? Okay, Sue, oh, fabulous. I love it. And then I didn't quite see, I didn't go all the way up. Let me go here. Twyla, Kim, either of you?
No, I haven't.
Okay, all right. And Cora, I didn't see, did you raise your hand? Nope.
I have not. I have talked to legislators separately, but not formally.
Okay, all right. Well, I love just hearing that the engagement has happened at all. And one of the things that I want to just truly, I think, emphasize here as we move into the action items is that you do not have to have formalized training to have conversations with legislation. These are people that we elected that, you know, truly are working on our behalf, and they need to know the issues. And if you can have a cup of coffee with someone, you can be an advocate. That's really as easy as it is. And so I just want to remind you that it's not something that you have to be afraid of or nervous about. It's truly about just reaching out and talking about what you're passionate about, which is suicide prevention. So in this next slide, there's some key things that you can do, and it's really about your comfort level. But when we're talking about taking action, I know some people are keyboard warriors, which is fantastic. You've got to keep those emails going. And what I really appreciate about the AFSP is they make it incredibly easy. Some of us are good writers, some of us are not. Some days we have off days, but they do a wonderful job of sending out, I would say, the strong template for you that you can either just sign your name if you want, or you can add your own personal message. But every time you see those come through, I think take that 2 seconds, take that whatever, how many moments you need. I was surprised, Senator Hoeven, this last round that I signed something about one of the veterans bills going through. Actually, one of his assistants called me personally and asked if I had any follow-up questions. So those types of small, what we consider small efforts, they make a difference. And so I think we have to have enough confidence in what we're doing and in the value of our voice to know that this matters. The other thing that we can do is set up meetings with our local legislators. And I know some people have indicated that when you did register, there was that option to say if you were interested. And we'll talk about that a little bit at the end, Sam and I. We want to be here to support you. So if it's your first time doing it, we want to be there and be your best cheerleaders. Also, this is kind of, it actually took me aback, but it says share your connection to the cause through a vignette. Well, a vignette is just a lovely, lovely way of saying your personal experience. And what is it that you've had as far as your own story? And I think, again, at the root of every culture, and I say this with, I think, heart, that we often are changed the most when we tell our personal stories and we share who we are. So, take some time to think about what your vignette is and what your experience is. And again, as Sam said, really ponder it, practice it, and think about how you would share that with someone. One of the other things I really kind of try to do, and I'll be honest, I'm kind of growing and trying to learn and be better at this, is engaging and recruiting other advocates. And I don't necessarily think it has to be as solicitous as it sounds, but it's truly just about being passionate. One of my best role models was my dad, and he was an amazing advocate just because he was so excited about what he did. And so he would talk about it with everyone. And he didn't realize that he was indirectly recruiting others to support and be part of what he was doing simply by his enthusiasm and his passion for it. So a lot of times we just have to be willing to talk about when someone says, how's it going? What are you doing? Well, I'm doing this amazing thing. I'm advocating. Can I tell you about it? I'm so excited. And finally, I think, sometimes for those of us who are maybe not such big hashtag, kind of what connoisseurs, go ahead, throw it in there. The AFSP always is nice enough to give us the examples of what we can use, but tagging the national offices, and then of course, hashtag AFSP advocacy, that really does help. It seems kind of simple, but simple sometimes does exactly what we need to do, which is it gets our message out. So getting ourselves as visible as possible. Alrighty, so on the next one, I just want to show you a little bit here. You probably have seen this before. This is very similar to some of the kind of templated emails that you're going to see as far as rolling into your inbox. But again, extremely well, I would say, kind of constructed, easy to do. It takes you probably as much as it does to scroll through your phone and check your own emails, or less time to do that, which is what I love about the system. So it's really up to you. But again, when you see them come through, just take a couple seconds, add your name, send it out. And then here's the thing that I think is really helpful too, is don't forget to forward it on to other people. Let other people join in. So that can be a very kind of, I think, soft way that you can include people and get them, I think, aware of what we're doing and how they can be involved. So let's go ahead and, Sam, do you want to go ahead and bring forward that next slide? We've got just a short little video here. And again, it might seem a little bit intimidating or overwhelming in the beginning if you've never met formally with a legislator, but we've got a nice little kind of, I would say, sample video, and I think it gives a nice kind of overview of what it might feel like. So go ahead and hit play anytime when you're ready, Sam.
Want to make a difference for suicide prevention and mental health? Want to get the attention of your public officials? Want to save lives through advocacy? Here's how. Public officials listen to their constituents, and that's you. Advocating for suicide prevention is easier than you think. So get ready to take action, advocate, and save lives.
When advocating at the state and local level, and sometimes at the federal level too, you may have the opportunity to meet with your public officials. Today, we're meeting with Council Member David Grasso.
Get organized. Have the materials you plan to share ready. You must be on time to your meeting. Early is better. Decide who is leading the meeting before you get there. Practice sharing your story out loud. You might want to do this in front of a mirror or with a trusted friend or family member. Keep your story to 2 to 3 sentences, 30 seconds or less. Decide what you are asking for and how you are going to ask for it. Collect yourself before the meeting. Calm those butterflies, and now you're ready to advocate. Introduce yourself. Thank the council member for meeting with your group.
Council member, it's great to see you again. Taylor and I are here today representing the American Foundation for Suicide Prevention for our first ever advocacy day here in the district. So thank you so much for taking the time to speak with us.
Well, it's my pleasure.
Ask how much time for this visit.
How much time do we have today?
Thank the council member for previous support, if applicable.
It just means so much to me, both personally and professionally, that you introduced the Youth Suicide Prevention and School Climate Survey Act back in 2016 to require educator training and school policies in suicide prevention. Thank you so much for your leadership, for being a true champion on this issue.
Share your personal story. Ask other group members to briefly share their stories.
I've been with the foundation for about 10 years now, since losing my brother to suicide. He was in high school when he died, so it just means so much to me.
So I'm also a field advocate, and I have a number of family and friends who struggle with their mental health and with finding the necessary resources.
Share the AFSP national and state fact sheets and underscore that suicide is preventable. State there are steps the council member can take to support prevention efforts and share the talking points and legislative needs.
As you can see here, suicide is the 15th leading cause of death in Washington, D.C., the 10th leading cause in the country, but we know it is preventable.
Which brings us to our 2 asks of you today. The first bill would require regular training for health professionals in suicide assessment, treatment, and management.
And the second bill we'd like you to support would address suicide prevention on college and university campuses. We've also included some language for a resolution making September Suicide Prevention Month, if you'd be interested in introducing that this year.
That's great. I really appreciate the advocacy, and obviously I'll look closely at your materials. In fact, I'll be happy to put you in touch with my staff as well to make sure that they have your contact information and you have theirs to work on these bills as well as perhaps introduce the resolution. So thank you.
Request to take a picture with a council member if time. Give folder to the council member, shake hands, and be sure to say thank you for their time. Write down notes from your meeting so you can report back to the AFSP Public Policy Office. So that wasn't so hard, was it? Your AFSP advocacy does make a difference, whether it's on the local, state, or federal level. Start planning your meetings with your public officials now. The AFSP Public Policy Office is here to help you along the way.
So I hope that gave you a little bit of a taste of what it might feel like. I have been on a few meetings of this sort in the past, and certainly some have been smaller, some have been with a group of people, but I would absolutely 100% say that that's pretty similar to what it feels like when you go in. You may or may not have a lot of time. Sometimes you literally have maybe 10, 15 minutes because they're in back-to-back meetings. But what I really think is important for that takeaway is to think about the 3 critical pieces, which is sharing your story and why you're there and your connection to the organization, giving them a little background on why your issue is important, and then really making that formal ask and asking them to support a specific bill or piece of legislation. So again, I think, there's a lot of tools that the AFSP has provided, and we really are just simply asking you to share your own personal connection. If you do end up making some meetings or having some meetings with legislators, we do really kind of encourage you or ask that you fill out an electronic legislative meeting feedback form. The link to that form is actually, I believe, shared with you over email that was sent prior to this event. If you didn't get it, just let us know. We'll be happy to send it to you again. But what's really valuable about it and why we really ask for the feedback is that we want to know who you met with, and then of course what issues were discussed, so that, you know, if the chapter or our offices, you know, on the national level need to help kind of do some follow-up or added support, we can be there to help drive that issue forward. The other thing is, if let's say you were hit with a question that you didn't really know the answer to, again, this is a great time to kind of enter that question into that legislative electronic feedback form, and you know, just kind of have that opportunity to get that information out. But I really do encourage people to send a thank you. If it's an email, great. I've done handwritten notes. Those are always nice too, and believe it or not, they actually do appreciate them. And I think, you know, making sure that you are remembered or that there is that note of connection. One thing that I would tell you that I would just kind of bring out as a piece of experience is that many legislators are incredibly overwhelmed with information, meaning there's a lot of issues that are on their desks, literally and figuratively, when they're going through sessions. And so I was surprised when I would meet with them at how quickly they had to get educated in all these different bills that were going through. And really, you know, when you come in, you are a resource to them. You are helping them understand better why these issues are important, but also to get better connected to what these types of changes could do for the community. So see yourself as a resource, and they'll see you as that as well. So we also have an event survey for this session tonight. So feel free, give us any sort of feedback you want, good, bad, or otherwise. But if you have questions, I really encourage you to reach out. I'm happy to have one-on-one meetings and just chat or kind of brainstorm, whatever works. I am available.